meeting. I take great pleasure in introducing Dr. Louisa Williams, who received her naturopathic training at Bastyr University. She holds a master's degree in psychology, always worries me, and a degree in chiropractic, and is the author of Radical Medicine, which is in itself a wonderful departure from the world of, well, drill, fill, and bill in dentistry and see ya in medicine. You know what that is, right? You show up, we see you, write your script and see you, and that's it. So, Dr. Williams.
Thank you, John.
Appreciate it.
So, thank you for asking me here. It's such an honor to present in front of my favorite dental group, and it's so great to see friends. Some of them I hadn't seen in 20, 25 years. Feel like we've been through the wars together, you know, as holistic physicians and biological dentists. We have been through the wars together, so thank you so much for allowing me to present here. My first presentation is on Naturopathic Prophylaxis. It's there in your notes. I've changed the name a few times, sorry. And I never know how long these talks are going to go. So why don't we go ahead and get started, because at the end I have I'm going to be having you guys workshop together on a new test I want you to try and perform in your office. So I want to have enough time for that. All right, so you all know this, but what changed in April 2007? After over 50 years, what standard of care was largely discarded that was very significant for all dentists, but especially biological dentists? There you go. Antibiotic prophylaxis. It was no longer advised for mitral valve prolapse and mitral valve disease typically, which is a big population, rheumatic heart disease, bicuspid valve disease, aortic stenosis, and regular congenital heart conditions. However, it was still advised for high-risk patients, serious congenital heart conditions, patients that had undergone surgery, artificial heart valves, a significant history of infective endocarditis, and I think this isn't in your notes, but I added recently the first 2 years following joint replacement, which is a sizable percentage nowadays, right? Lots of patients of ours are getting hip and joint surgery. So what happened is American Heart Association, a group of 23 doctors, along with American Dental Association dentists, got together and did a retrospective study for 56 years. They did this huge longitudinal study of a Medline search to try to figure out if giving antibiotics for the transient bacteremia after dental drilling or any kind of dental procedure was indeed worthwhile. And Walter Wilson, the head of the group, concluded that only an extremely small number of bacterial endocarditis affecting the valves or infective endocarditis might be prevented by antibiotic prophylaxis for dental procedures if it was even effective. And he went on to say there's actually no evidence that it works after 56 years of giving patients preventive antibiotics, which is a huge population. And I kept looking in the article for, where's the I'm sorry or anything. Can you imagine if naturopaths for 56 years had been giving echinacea and then we found out it doesn't even work? Anyway, no I'm sorry. It's just this is what they had found. So, no research, no prospective randomized placebo-controlled studies. Of course, this policy, this recommendation began in the 1950s, throwing antibiotics at everything, right? It was kind of like that was the style, that was the standard of care at the time, and it just kept going, which for many people it still does, overprescribing of antibiotics. So, for us biological dentists and biological physicians, I like that, John, biological physicians too. If we look in the mouth and work with dentists, we're biological physicians. Yeah, I like that new term. So for us, it was an excellent change because, we don't like giving antibiotics unless it's really necessary. because we know the side effects and the real damage to the gut and the dysbiosis that it can cause. George Vitulcas, a very famous Greek homeopath, wrote a good book on the damage from antibiotics and other drugs, and a new model for health and disease is the title. And he said that our quality of health depends almost entirely on the quality of microorganisms that exist normally within our bodies. And if our gut's healthy, our immune system's functioning. Just as simple as that. So antibiotics have been labeled as ecological marauders by Dr. Nigel Plummer. He's a British microbiologist, an expert on antibiotics and dysbiosis and also probiotics. So he has found that cephalosporin, erythromycin families are capable of eliminating 99% of lactobacillus species, the most common microorganism in our esophagus too, by the way. There's lactobacillus predominantly in our esophagus as well as in our intestines, especially small intestine. Of course, we know that our bodies have the ability to recolonize after a bout of antibiotics, but if you're eating sugar and a toxic diet and you've had a lot of rounds of antibiotics, that gets less and less possible. This bug here. Alexander Fleming, who accidentally discovered penicillin, right, was quite honest. In the early 1940s, mid-1940s, he cautioned people the misuse of penicillin could lead to mutant forms of bacteria resistant to the drug back in 1945, long time ago. So good for him and his honesty. He was already seeing this in his laboratory. So now we have MRSA. We've had MRSA for quite a while. In the 1950s, penicillin was 95% effective in killing Staph aureus. 95% effective in the 1950s. Now we have methicillin-resistant Staph aureus. These little bugs have figured out how to be resistant to the methicillin. And doctors in hospitals where these infections run rampant started using vancomycin. Well, then vancomycin started having resistance to Staphylococcus. The vancomycin-resistant Staph aureus bug bacteria figured out how to thicken the cell wall so the vancomycin couldn't get in. And we know that MRSA infections are very dangerous. These are the flesh-eating bacteria, so-called necrotizing fasciitis, where it eats away of the skin and the subcutaneous tissue and even the organs, causes toxic shock syndrome, and cause death. So it's a very serious problem. So antibiotics aren't the answer. They were in the 50s. They were amazing at first, but as anything that's toxic and synthetic, it won't hold up in the long run, right? We know that. It just won't hold up, and it's not holding up. So nosocomial infections, hospital-induced infections. Another one is the Clostridium difficile. This bacteria is resistant to antibiotics. This one's so pathogenic it literally peels off the lining of the intestine. Very dangerous. I have a patient in Rhode Island. He's 85 years old, and he's just gone through that. And we've got him back in good shape, but he was in the hospital twice and almost died. So it results in a very explosive, debilitating, and often lethal form of diarrhea. So often what they use for Clostridium difficile is vancomycin, and that's not working for Clostridium all the time now anyway, and so sometimes they'll use metronidazole, which is Flagyl, which nowadays has a warning label, has caused cancer in mice and rats. Literally, that's a dangerous drug to take. But it's like, where's the biggest gun? What do we do now? This doesn't work. Then what do we do? This is a very important study. Antibiotics, overuse of antibiotics can cause cancer. This is a Washington State study, more than 10,000 women. There were exactly 2,266 women older than 19 with primary invasive breast cancer. And then they had this huge control group, 7,953 random control group. And they found that women who have taken more courses of antibiotics have double the chances of getting breast cancer. I can't tell you exactly how many rounds of antibiotics that was, because it was based on the age, so it was more a percentage thing. But this is a very important study, well-controlled study. There was only one other study before that. When you think about it, who's going to fund these studies? It's not like the drug companies are going to fund this. So there was a Finland study in 1999 before that was reported in the British Journal of Cancer in 2000, and in Finland they found that women with chronic urinary tract infections that took antibiotics a lot were much more prone to get cancer, and they even controlled for the urinary tract infection bacteria. So it wasn't the bacteria, it was the antibiotic use. So is Dr. Huggins here? Not yet? He's in the other room. Okay. Well, I love Hal Huggins because he says things so clearly. So in a recent Weston A. Price journal, he said antibiotics are not like John Wayne, right? And we feel that way, and you hear patients say that sometimes, like, I'm just going to break down, I'm just going to take the antibiotic and get rid of it. And it does cause, short-term usual decrease in symptoms. But Dr. Huggins said when he fired at the bad guy, John Wayne, the bad guy fell over dead, right? You're going to kill the bug. When, in fact, what happens in our body is the bacterium explodes. We don't have the knowledge and wisdom of the immune system sending out macrophages and white blood cells and CD cells and quarantining and getting rid and eating up of the particular bacteria. We have an explosion, hundreds of bacterial endotoxins, fragments of the pathogenic bacteria, and then the body must try to eliminate them. So autoimmune disease is a result of this, giving so many antibiotics that the tissue just gets more and more congested. And what happens with all these foreign proteins and foreign toxins and byproducts of chronic infection is that the tissue no longer recognizes itself. And autoimmune disease, as you know, is just epidemic. Now, the Merck manual, our conventional medical manual we all study, has actually clearly said lupus, interstitial nephritis, myasthenia gravis. It's already admitted to several autoimmune diseases that are clearly the result of taking antibiotics. Now, when you think about it, most autoimmune diseases are rather slow in coming, right? So these are just the ones that are obvious most of the time. Who knows how somebody develops an autoimmune disease? So another autoimmune disease that is rather a new acronym is PANDAS. Many of you have heard this, and this is an autoimmune disease due to the tonsils. This is pediatric autoimmune neuropsychiatric disorders associated with streptococcus infection. So after a sore throat, after tonsillitis, after otitis media, children can begin to exhibit obsessive-compulsive disease syndromes, chorea-like movements, involuntary movements, tics. It's very similar to Tourette's. And in the old days, Sydenham's chorea, which has been around for over a century and has been written on, that was that wild St. Vitus dance when the involuntary movements were very strong. That's been recognized for over a century as a result of streptococcus bacteria. It causes these neurological symptoms. So when I have a Tourette's patient, what do I always look for is a tonsil focus. Be sure and ask about the history of that. And usually it's after tonsillitis and then antibiotics, and that just drives the autoimmune disease in deeper. Now, unfortunately, what's the conventional treatment? They're blaming it all on strep, not the antibiotics too, and the conventional treatment is just more antibiotics. So, I have, you won't find this if you Google it because I just made this up. But this is called Grandas, and we all know as biological dentists and physicians, what is Grandas? Well, it's a chronic tonsil focal infection. A chronic tonsil focal infection, which are really even harder than dental focal infections. So this is for all of us adults that still have a little OCD or tics or worry or anxiety. Huge population of patients. So how do you diagnose grandas in an adult? Well, the person almost always has a significant childhood history of sore throats, tonsillitis, ear infections, and then what they remember of how many antibiotic rounds they took. You know, it's hard to say. As an adult, you may or may not have sore throats and swollen glands. Sometimes you can, or you may have no symptoms at all. Now, we're talking about everybody, not just people that haven't had a tonsillectomy. Without a tonsillectomy, you can still have these symptoms, because remember, we have 5 tonsils. We don't just have 2. We don't have the palatine and pharyngeal tonsils only, right? We've got the tubal tonsils that relate to the ear, the lingual to the tongue, and the laryngeal to the windpipe, to the larynx. So this Wall-Dyer's ring is all going to be infected, as well as the chain of lymph nodes in the cervicals. You can't take it out. You can't slice it all out. You can improve things, but it's better to treat it, you know, holistically, treat the whole body. So chronic tonsil and focal infections are grandas as an adult, anxiety and obsessive roaring, subtle compulsive movements, tapping, twisting your ring on your fingers, knee jerking, fidgeting, constant clearing of the throat, little tics. I know, well, I've had these things. So, and of course, as adults, you know, we cover it up. You notice you're kind of, you know, doing this with your leg, or, you know, fidgeting. And you know, you could say, what is that? Why isn't my nervous system quiet and relaxed and enjoying this beautiful Carmel weather? What's going on with this? A lot of it is Streptococcus bacteria in our tonsils or in that lymphatic area, causing chronic autoimmune neurological stress. So, the good news. So the new April 2000 guidelines, I think we were all really excited about that, because it will reduce antibiotic resistance and antibiotic-induced illnesses for a significant percentage of the population. However, what's the bad news about that? Well, what do we do about bacteremia, bacteria migrating in the bloodstream to different areas in the body after any kind of dental work? So is bacterial metastasis to the heart, for example, after dental drilling significant? So here's some research studies. Just periodontal probing, measuring pockets in patients with gingivitis and periodontitis, creates significant bacteremia from 10 to 40% of the time. Well, we'd agree with that, because when you have gingivitis and periodontitis, obviously you're going to have bacteremia. So these are a more vulnerable population, but many of our patients are quite a vulnerable population. Bacteremia from dental procedures, interligament injections most of the time, 90% of the time. Wedge band placement, 32. Rubber dam placement, 29. Polishing teeth, 24. This is in pediatric cardiology, though. So this is a healthy population of children. So this is just in, healthier children, not even in adults that have more chronic illnesses. Bacteremia from extractions. Again, we're talking about children, no history of disease. Extractions in children cause bacteremia 69 to 72% of the time. It's measured by blood cultures, and studies indicate bacteremia from extractions 39 to 100%. Of course, extractions really cause a lot of bleeding, and that goes into the bloodstream and can be measured afterwards. As we said, patients with gingival disease are more susceptible. Of course, this study was 100 children aged 1 to 8 years old. How many children have that significant gingivitis? Isn't that funny? Yeah, but this was in Journal of American Dental Association. They found it. So even toothbrushing, we should be taking antibiotics right after we brush our teeth at night. Even toothbrushing, manual brushing, 46%. Electric toothbrushes, 78%. So, well, what does that mean? Eating or chewing gum causes bacteremia. So now you're thinking, well, lots of stuff causes bacteremia, right? But to our patients, that can be a very real threat to vulnerable populations. When I used to be less healthy, I'd go to the dentist and get cleaning, and I would feel bad afterwards. I'd have patients feel bad after, especially sensitive patients. And we had means of, taking products and stuff to reduce that bacteria, just even after a cleaning. So bacteremia, the bacteria in the bloodstream and also in the lymphatics and walking along the nerves through axonal transport, that's a very real threat, and it increases the load on any existing bacterial focal infections. Let's talk about bacterial endocarditis. So bacterial endocarditis is an infection of the endocardium affecting the inner lining of the heart and its valves, mainly the valves. Now, is bacterial infected endocarditis that rare? Well, it's hard to say because it isn't seen and it's not diagnosed that often. Now, here's a more broader definition of bacterial endocarditis, rheumatic fever. Rheumatic fever nowadays, you don't hear about that much either, right? It's an acute inflammatory complication of the strep bacteria, and it affects the joints, the brain and the heart, right? Because it's characterized by arthritis, chorea, again, central nervous system distress, and carditis, heart pain. So with residual heart disease as a possible sequelae of that. Okay, so this is usually after dental drilling or some kind of trauma or like that. The patient comes home and they get severe flu, and then they go to their doctor and they're diagnosed with rheumatic fever. So what did Weston Price say that the two worst things were in life in regard to stress to the immune system? What were the two worst challenges in life? Divorce and death. You're close. So Dr. Price said the two biggest challenges to our immune system in life are pregnancy. It's a big deal. Woman has to really be taken care of, nourished, and flu. Of course, he lived through the 1918 flu. But this is what this rheumatic fever is. It's characterized by like flu-like symptoms, which are sometimes diagnosed as rheumatic fever, often missed. Rheumatic disease, just to review this, is any disease of streptococcal bacterial origin. Now again, this used to be a lot more common and talked about in the 1950s, 1940s, but then when antibiotics came in, as soon as you gave an antibiotic, yes, that did reduce the symptoms, so it's not talked about so much. But we know what the antibiotics do. They kill some bugs, other ones cause later problems. So as biological dentists and physicians and practitioners, we know about silent focal infections. That's why I love this group, because we're very aware of these chronic silent focal infections that conventional dentists and doctors aren't aware of at all, and sadly, holistic practitioners and physicians aren't very aware of at all. So what are typical focal infections? Dental, tonsil, sinus, genital, other foci. And what do these focal infections do? They're chronically like a machine generating pathogenic bacteria. And they're going to migrate and metastasize typically to the what's called rheumatic disturbed fields in the body. Rheumatic, streptococcal related, places that make a happy home for strep bacteria, where strep bacteria like to live. And there are 5 main rheumatic disturbed fields. First of all, the heart. Again, the endocarditis to the valves. Rheumatic fever includes all of these areas, 3 of these areas. Joints, chronic rheumatoid arthritis. Kidneys, acute chronic glomerular nephritis. The gut, appendicitis, stomach, duodenal ulcers. And we already talked about the brain. In the old days, they called it chorea. Nowadays, we call it Tourette's. It's really the same thing. It's interesting. Tourette's was diagnosed or identified by a Frenchman, Tourette, in an 86-year-old woman in the 1880s. Unusual, huh? Because nowadays we see it in children and teens, and usually after that, except for 10% of the time, the patient adapts and it's not so obvious, those kind of symptoms, or they grow out of it, as they say. Pandas, grandas, and then this whole epidemic of ADD, ADHD, hyperactivity in kids, all manifestations of strep bacteria. So I want to mention Edward Rosenau. Who knows Edward Rosenau? Such an amazing man, and if you do get my book, I hope you'll read that history, as well as, sweet George Meinig's book, The Price of Root Canals. The turn of the 20th century was just amazing. That was just the hallmark. That was the time of focal infection theory that was just exploding, and we had incredible research that doing root canals became such a thing, giving antibiotics in the 30s and 40s. There's this huge backlash to that. And then it all died. And we're the ones, taking up the reins on that and telling people, yes, focal infections are real. We have to address them. You can't diagnose what you don't know about and treat. So Rosenau was considered a research genius. Later, Mayo Institute recruited him because he was an amazing biologist, amazing man. And he found that streptococcal bacteria love this partial tension of oxygen. They don't like anaerobic areas without oxygen. They don't like aerobic areas. They like this partial tension of oxygen. And also that streptococci, along with that, have a specific pathogenic affinity for certain tissues. Well, what are those certain tissues? They love the heart valves. Again, that's a partial oxygen environment. Mitral valve first, aortic valve second. Very common for patients to come in with some kind of diagnosis of mitral valve disease. Minor or moderate or significant, usually minor to moderate. It's a very common finding, and what it is strep bacteria metastasizing to that heart valve. And it can be mitral valve prolapse, stenosis, or more serious regurgitation. The strep bacteria also love the joints. They love the joint capsule, that synovial fluid, very warm, nice, happy little environment for them. That's why we have so much arthritis. Again, partial tension of oxygen, partly oxygenated. Same thing with the kidney glomeruli, same thing with the frontal cortex and the brain. All these tissues are very good areas for the streptococcus to live and to thrive. So Rosenau did this same research that Dr. Price did too, and we all know this research that Dr. Price in Cleveland. Rosenau was at Rush Medical College in Chicago. Dr. Price was in Cleveland. There was a lot going on in the Midwest. The Midwest was really popping then with all these scientists studying focal infections. So Dr. Price put together a team of 60 leading scientists. What an amazing man. And that included Dr. Milton Rosenau, not NAU, not the same one, of Harvard, Charles Mayo of Rochester. We know what he ended up doing, the Mayo Clinic. Dr. Frank Billings of Chicago at the Rush Medical College, who also, that's where Rosenau worked. And what he would find is if he took an infected tooth, an infected root canal tooth from a patient with heart disease and pulled that tooth, extracted it, cavitated it, well, I hope, and then he put it under the skin of a rabbit, that rabbit would develop the same disease, whether it was ovarian disease, pelvic inflammatory disease, heart disease, skin disease, anything. It was so well correlated. It was amazing. It was almost like that strep bacteria had grown to that particular affinity, and then it would want to go to that same place in that animal, right? I was in a joint before, I'm going to go to a joint again. Wanted to find a home again, right? So I know a lot of you know about Price's research on this, and a lot of other doctors did research and found the same issue. Now later on, detractors, which we're feeling because this focal infection theory isn't popular nowadays, detractors tried to do the same thing. Other scientists did, and they didn't do it properly. They didn't put the strep bacteria, they didn't keep it in a partial oxygen environment. They said, oh, this isn't true. So you have to do the research correctly. So let's talk about focal infection parlance. I see tons of old friends here. Maybe some of you are new and don't realize that our biological dental group were very into focal infections, the diagnosis and treatment of those. So the two main ones, of course, the teeth and the tonsils. That's the cause, okay? And the disturbed field is the area, the rheumatic field, the area like the heart valves or the hip joint or the kidneys or the brain, okay? So if you have an impacted wisdom teeth, often those are silent with intermittent little pain and swelling. You're not even thinking about your heart. Or if you have a root canal infected, or if you have an abscessed tooth, or if you have an incompletely extracted wisdom tooth and a focal infection site there, all of these areas continually generate bacteria and go to susceptible areas in that patient. And of course the patient, there's also the patient's miasm, right, or condition or heredity. But really, those of us that know about epigenetics nowadays, that it's really not the genetics itself. Genetics is really only 5 to 10% of the time the problem. Epigenetics says you can completely change your life based on your environment. You don't have to be prone to heart disease just because your family was, or your ancestors were. So I love this quote from Dr. Price. Modern medicine is mistaking effect for cause. Modern medicine is mistaking effect for cause. So, as we said, this may be a new slide. No, you have this in your slide? Okay, sorry. I added a few new slides. So I just love this quote. Treating a patient's joint or heart disease without examining the strong possibility of a focal infection in the teeth or tonsils. When doctors are doing that, they're treating the effect, the symptom, rather than the true cause of the problem, the focus. Now, the problem is patients come to us and talk about their hip joint or their heart pain. Okay? They don't come into you guys that know about dental focal infections. They're just talking about teeth. So as biological physicians and practitioners, we elicit the teeth information. As biological dentists, y'all need to elicit, as you do, the whole systemic history, the whole history on what's going on in the body. But this is so important, meaning that as biological dentists and physicians, we've got to treat upstream, not just downstream. We've got to treat the cause. And dental and tonsil focal infections are epidemic. Every single one of you in this room probably has one or the other. Now, Speransky was a renowned Russian physiologist, and he talked about this trigger factor. And he was saying that chronic, relatively silent dental focal infections can flare up from a second insult, and I just added as dental cleaning, drilling, extraction. So again, what we don't want to do when we have this bacteremia in the bloodstream is that we don't want to trigger a dormant heart disturbed field and be part of the cause of a heart attack in 3 weeks, or triggers more bacteria to load onto the patient who already has existing dental and tonsil focal infections, already has a lot of bacteria on board. So what can we do? So silent heart disease, a little bit more about the mitral valve. The mitral valve is the main valve that gets injured. This is very common mitral valve disease. It's the most commonly disturbed and infiltrated and infected valve in the heart. The second is the aortic, third tricuspid. Now, again, heart disease, even though it's a disturbed field, and we're saying disturbed fields are usually symptomatic, this disturbed field is usually rather asymptomatic. Patients say, sometimes I have palpitations, shortness of breath, dyspnea, angina, heart pain, and fatigue. But often this deposition of strep bacteria causes very little symptoms. Mitral valve disease, rheumatic heart disease without a history of rheumatic fever. Well, as we said, rheumatic fever, flu gets missed all the time, depending on how strong the symptoms are, often undiagnosed. Or you take antibiotics prophylactically and you just never know you have it, which some people will say, well, that's good, but there are better choices. So, do you have heart disease of any kind? So a conventional medical history would ask, do you have angina, heartburn, shortness of breath, fatigue? Our patients come in complaining of fatigue like, it's number one complaint nowadays. And we, think of the adrenal glands or the kidneys. Think of the heart. That late afternoon fatigue is often the heart. reduced circulation in the body causes a lot of fatigue. Palpitations, tachycardia, weakness, dizziness, nausea, sweating. Now what we ask additionally is, did you have a lot of tonsil infections as a child? Did you have a lot of ear infections? Did you get a lot of antibiotics for that? How many rounds? Do you have any idea? Did you have a lot of sinus infections as a child? Is this a new slide too? Oh, good. Okay. Do you have gum disease, right? Dental cavities, abscesses, root canals, extractions, who pulled your wisdom teeth, the conventional dentist, it's always the same thing. There's very few people that extract correctly. So we have to ask all of these questions. And these are 2 new slides. I just have to throw in my information on cholesterol. I just saddens me so much when I see all of us, especially senior citizens, just getting beat up by the side effects of statin drugs. It's outrageous. So this is a very good website. Benefits of high cholesterol. You go to the WestonAPrice.org and you Google benefits of high cholesterol, and you'll see excellent peer-reviewed journal articles in this particular article talking about the scientific basis of the fact that cholesterol really doesn't cause heart disease. Trans fats do. Toxic fats, rancid fats, sugar, those things cause heart disease. We'll be talking about that next. So, some facts about cholesterol. 75% of people who have heart attacks have normal cholesterol. 75%. Older patients with lower cholesterol have higher risk of death than those with high cholesterol. Countries with higher average cholesterol, like Switzerland and Spain, have less heart disease. So there's just tons of facts on cholesterol and how important it is to the system. Had a patient come in recently going to a Kaiser doctor. Her doctor wants to get her cholesterol down to 120. Yeah, AIDS patients. What are AIDS patients? 150, 140. They keep lowering this cholesterol. It's the most insane Emperor's New Clothes thing I've ever seen in my life. It's amazing. Okay, some research on statin drugs. And again, I think Sally Fallon has done a very good job of compiling a lot of research statistics on statin drugs and cholesterol. So again, go to the WestonAPrice.org website and just Google statin drugs. This is the thing. When they first got the board together to figure out who to recommend statin drugs to, they couldn't figure it out for women. Because women, even at 200, 250, more than that, there was no evidence that caused heart disease. But nevertheless, I think they first said it at 200, then they've gone down to 180, now they're down to 170. But a healthy woman, there's no evidence that taking statins reduces your risk of heart attack and death. Lancet, respected British journal, 2007. Men or women over 69 years old with high cholesterol, there's no proof that taking statins reduces your risk of heart attack and death. Same article. And here's an article where two statin drugs, Zocor and Zetia, aggressive treatment with them, they did lower cholesterol, but it led to more plaque buildup. What does cholesterol do in our body? It goes to the intima of the artery. It's there to heal that infection, that inflammation, right? So it led to more plaque buildup in the arteries and no fewer heart attacks. New England Journal of Medicine. So I just wanted to say that, and any of you that are on statin drugs, I really wish you'd do some research and consider or reconsider taking that medication. It has some serious side effects, including death. Okay, how many do a blood pressure in your office? How many take blood pressure? Oh, quite a few. Okay. So what can we do for the physical exam? Blood pressure is an excellent test. I find the blood pressure machines give a lot of false positives. So those can be a bit of a problem. So if you are going to buy a blood pressure machine, I'd caution you to go with a lot of money. Buy a really good quality one, because the cheaper ones usually give too high a reading. So blood pressure is a good measurement. The pulse is also a very good measurement. Now, we're supposed to take our stethoscope and diagnose the heart sounds. So when you're in school, you get a tape and you get this information on all these particular sounds you're going to hear. When you listen with your stethoscope on the chest, I just want to say it's very difficult to diagnose heart sounds. Even cardiologists are challenged by this, and they confirm these heart sounds by echocardiogram studies and ECGs. So, you can take your stethoscope and listen, but don't worry about, doing it just right, because it's difficult. We leave that for the cardiologists, the doctors that listen all the time. Now, left ventricular hypertrophy. This is a very common complication from rheumatic fever, from strep bacteria, with resulting mitral and aortic valve disease. Okay, so here we have the left ventricle, and we have the mitral valve right between the left atrium and the left ventricle that brings the oxygenated blood from the lungs into the left atrium, goes through that mitral valve, goes into the left ventricle, and then that left ventricle has to push out all that oxygenated blood through the aortic valve into the whole rest of the body. So our left ventricle has a huge workload. It's our main pumping chamber. And as you can see, what can happen, just like Hans Selye said about the adrenal glands in the 1950s, that brilliant doctor and scientist, the adrenal glands with a lot of stress, what do? They hypertrophy too. Glands and areas get bigger under stress. Well, so does this muscle, so does this left ventricle area. So, why don't everybody put your hand on your heart. Remember, the seventh rib comes out here where the xiphoid is, so the heart ends at the fifth rib. 1/3 of it is to the right of the sternum. 2/3 of it is to the left of the sternum. And it's about 2 fists, size of 2 fists. Small person, those person's fist. Big person, those person's bigger heart. So if you should be feeling a beat, that is the left ventricle. It's the most anterior to the chest wall. So you're feeling that apex area, that apical area of the left ventricle. Now, if it's forced and strong, you well could have left ventricular hypertrophy. It's not an uncommon finding. Here's another picture of the thickening of the myocardium. Of the left ventricle. Very common in hypertension. Of course, you increase the peripheral pressure. The body's got to get stronger, just like building up your biceps in the gym, to force more blood so you get the blood circulating throughout the body. It occurs naturally in athletes. We'll talk about that in a minute. I'm not sure how natural that is. And it's diagnosed with an echocardiogram. Okay, another picture. Left ventricular hypertrophy, blood is unable to flow freely from the left ventricle to the aorta, as we said, during aortic stenosis. And remember, most people have some kind of mitral valve impairment too, by definition. And it can cause arrhythmia, ischemic heart disease, not enough blood getting to the tissues, congestive heart failure, and death. And often, see, the left ventricle is the first sign. And after a while, it can lead to right heart failure. So this is first to fail, and it's the strong pumping chamber, and then this is second to fail, the right ventricle. So if we catch the left ventricle first, we're catching it earlier. Now, there is a test in autonomic nervous system labs called the sustained grip test, and it's used as an alternative stress test to reveal cardiac abnormalities. And they say that it's necessary since cardiovascular function in many patients with clinical heart disease is within normal range. And I think we see this a lot in our practice. I can pick up heart issues, some kind of distress in the heart, and yet a patient can go out and get a normal ECG and, a normal echo, and yet I see heart issues, and they eventually will show up unless I treat that. So, challenging the left ventricle. So in 1967, this Dr. Donnell figured out how to do that, and he demonstrated that if you have a sustained isometric contraction of the flexor muscles of the forearm, in other words, those little teeth you have in front of you, if you squeeze that real hard for a sustained period of time, it resulted in a marked increase in blood pressure. You increase the peripheral blood pressure, you increase the stress on your left ventricle. That's no problem if you don't have a left ventricle problem, hypertrophy, but if you do, it results in a positive test. They've been doing this for over 30 years in autonomic nervous system labs. Again, another picture of the heart. The heart has to pump harder to get that blood out from the left ventricle through the aorta to the whole rest of the body. Can also do it with a Valsalva's maneuver, right? We know some of these parasympathetic nervous system stresses we can do in our offices. So, it's a very well-respected test. It's considered very simple, very easy, very safe, and it's a valuable intervention for the evaluation of this left ventricular function. Very, very well praised in the literature as a good test to do. Professional athletes. They did a study with professional athletes, male professional basketball players, 42 of them. 33, this is a new slide, sorry, added a few. 33 had left ventricular hypertrophy and enlargement, and 16 had bilateral hypertrophy, both sides. Now this is called physiological hypertrophy, because at their basal state, at their resting state, these guys were okay. Well, I don't know if I agree with that. What's the typical age of death of a professional male, a professional sports player, a male professional sports player? What's the typical age of death? Yes, Mike, you get a prize. 67. That's young, right? A lot of us are in that range. What's the typical age of death of a professional football player? Lower, of course, a lot of, fractures and concussions. 58. Professional football player, male. Oh, they all are male still, aren't they? No women yet. 58 years old. So I don't know. It's interesting that they consider professional athletes this is okay. And again, in our offices, we have tools and techniques to figure out, just how physiological, just how normal this is. I think a lot of people are doing their exercise completely wrong. So that's a whole other subject we'll have to talk about at cocktail hour. But I think there's a lot of mistakes with exercise. Okay. Well, of course, professional football players are also billionaires and millionaires and get a lot of glory. So there is that aspect. I understand that. But I would hope that all of them got, holistic health during their years and after their years of being in sports. So also, this is a very good test if you've had a heart attack and you're supposedly recovering, an uncomplicated recovery. If it's positive, that can indicate, yes, now there's still a problem. Again, you have to correlate these with other findings, blood pressure, pulse, symptoms, history, etc. But they use this test a lot, left ventricular function in patients, to see if they're really doing well after myocardial infarction. So, for biological dentists, the sustained grip test is an excellent screening test, along with the pulse, along with the blood pressure, to determine any heart impairment so that the transient bacteremia that may be mild from dental procedures, to make sure that it won't worsen an existing problem. Of course, we're already aware if that patient has gingivitis or periodontitis. We're already aware of the chronic dental focal infections. Some of you even take a tonsil focal infection history and have an awareness if they have a chronic tonsil focal infection. So we're aware of the state of that patient's health. So adding this sustained grip test to our screening is very easy to do. So what else can reveal underlying cardiovascular disease? Energetic testing, such as kinesiology. We all have been able to therapy localize the heart and see issues. Electrodermal screening reveals that. My technique, matrix reflex testing, very sensitive. I'm aware of any kind of heart issues coming up. We all know that a therapy localization, a positive TL, those of us that do kinesiology, is a lowered galvanic skin resistance point. Like if a patient has a chronic ulcer, there's going to be a lowered galvanic skin resistance over this area because of the high sympathetic activity. Think of high sympathetic activity, high sudoriferous activity, a lot of sweating, sweaty area, less resistance, right? So it's a positive TL over that positive TL area, over that stomach or over that heart area. So Dr. Irvin Kaur, a great scientist, worked with osteopathic colleges for years, did amazing research on proving the efficacy of therapy localization, actually. So he used a dermometer, which is just a fancy skin resistance machine. And he found that if that tested positive over the sternum, over the medial scapulae, and T1 through T4, that consistently correlated with heart disease in all his subjects he studied. In one subject, he had been studying this subject for months and months, but then for 3 weeks, this subject's T1 through T4 were observed to be testing positive before that subject had a heart attack. And we also worry not only about the viscerosomatic relationship, but what about the somatovisceral relationship? As practitioners and doctors, and especially as dentists, we're humped over a lot. It's really a problem. So this kind of stress in the upper thoracic area, is going to have a problem to the heart. They're going to reflex back and forth through these nerve pathways here. So they used to say dentists primarily die of heart attacks. I was trying to find that on the internet. I couldn't find it. I did read about dentists used to say that they committed suicide more than anybody else, but that was an urban myth. So I don't know what the normal death is, but it is a consideration because you know how much fine work you do, how much hunched over you are, and again, how prone you are to toxic chemicals and toxic metals. The Ziff brothers, we're not even talking about mercury yet, right? But the Ziff brothers wrote a book about mercury toxicity, mercury amalgam dental fillings, and heart disease. And then Sam Ziff later wrote another book on heart disease and mercury. So mercury is a whole other issue in regard to intoxication of the heart. So, autonomic lab tests are expensive, echocardiograms, ECGs, going through a cardiologist. These are all very complicated. Now, of course, and expensive for the patient. Now, of course, if you have a patient that's definitely indicating significant heart disease, you want to refer them to a cardiologist and get all that information. But for the most part, what we need is some kind of easy screening tool we can do in our office. So we can do a variation of the isometric hand grip test in our office using a ball or a dynamometer, and then observing if a strong indicator muscle weakens in response. Okay, so does anybody have a dental focal infection here, a tonsil focal infection here? Anybody a strong athlete? Who wants to? None of those. Clean. Who wants to come up? Russ, come on up, Russ. I remember, Russ, years ago you had a big bicycle accident, didn't you? You're a big bicyclist, right? Yeah, I thought so. Okay, so stand there. And I'm so used to taking off watches, but I guess I don't have to do that. Let's have you go ahead and take off the watch. Okay. Okay. Take the phone out. Take the pager. Okay. All right. So let's have him and get away from the electricity a little bit. Not that it's going to make that big a difference with just a gross muscle test, but okay. So we have this patient. Hold his arm up. Hold tight. And he's got a strong indicator muscle. You can also do the supraspinatus muscle. Get his elbow real straight, 30 degrees out from the body. Hold tight. You can check both sides. Straight up. Just a general indicator muscle or a more specific muscle. And he's super strong. Okay. So then you want to take your little ball that Dawn and Toby got for me and have that patient squeeze it for 15 seconds. Now, in your notes, it says 10 seconds. And the reason is because I don't have a watch. I don't like electricity on my body when I'm working in the office, and I don't have a Rolex, which works, so my watches have been broken for years. So what I do is I count. I usually count 1, 2, 3. I count to 10. Well, I just got a stopwatch for this conference and realized I'm counting so slowly it's actually 15 seconds. So I've been doing this test for years, but it's 15 seconds. Okay, so let's have the patient hold it in their dominant hand. Okay, so when I say go, Russ is going to squeeze that moderately hard. Not terribly hard, but not weak. Usually men around 20 pounds of pressure. Okay, so Russ, go ahead and squeeze. No, stop. Okay, wait a minute. Sorry. Okay, now squeeze. Okay, moderate hard, moderate hard. And stop. Now quickly, you want to retest a muscle, hold tight, and he goes into weakness. Okay? He's not holding it anymore. Quickly hold tight, and he goes into weakness. Now, you only have 3 to 4 seconds to quickly retest, because now, after that, hold up, hold tight, and he's absolutely strong again, right? Because this is a dynamic test. On the surface, he's fine, but underneath that, when he bikes 26 miles. I don't know if probably doesn't have any dental focal infections. Holistic dentist specializes in cavitation surgery, but definitely could be one of those physiological hypertrophy issues with the left ventricle. And it's something that we want to take into mind too, because I'm not sure if that's a good idea to go weak with any particular test. Okay, so Rush, why don't you sit down again? So, well, no, I'm going to keep your watch because I'm going to have you come back in a minute. Now I have a watch. Does it have a battery in it, Russ? Oh, it's a wind-up, or is it? It's a wind-up. Yeah, I have a hard time keeping my wind-ups good. If it was a Rolex, I'd keep it because the automatics work better. Okay. So now we recheck the indicator muscle, and you get a positive result. And that's a weak response of a previously strong indicator muscle. It's a positive test for the left ventricle. Now, Russ, within 4 seconds, 5 seconds, went into strength again. You don't have this slide. This is the preference pyramid. It's in my book. This is a picture that's been redone from the great Dr. George Batulkas's work. But basically, it's important to think about this physiologically as well as philosophically. We only have one brain. We only have one heart. We only have one liver. We have 32 teeth, or some thereabout. We have lots of bones, muscles, skin. So the body will try to detoxify through a rash and get rid of toxins before it will impair the heart. The body will do anything it can. We can lose a tooth, but we can't lose our heart. We can't lose our stomach, our brain, our more vital organs. So it's important to think about survival and how the body prioritizes in life. So often these vital organs are harder to therapy localize, harder to bring up because the body is protecting them. Now, how do we test rust? So what does he need now? CoQ or magnesium? Or what does he need for a focal infection? What does he need to treat, especially now that he's gone into strength? Now, we have this same problem, for example, if we're therapy localizing a tooth. If you do muscle testing and you're therapy localizing a tooth, and then you're trying to, put this product on and that product, this homeopathic and this herb, and keep that same position of that tooth, keeping it weak and seeing what 2 points. It's difficult. It's awkward, right? So how do we handle that with hard to therapy localize areas or dynamic tests that are only positive for a few seconds? We only get to look at that left ventricle for a few seconds, that issue. So this is another test that we've been doing for years, for decades and decades. This came from Dr. Alan Beardall, as well as an osteopathic friend of mine in Austria. And this is called the straight lock test. And the reason is the tooth is there is because we use it a lot for teeth. So if I'm therapy localizing a tooth, okay, I've got a strong indicator muscle, I therapy localize, number 30, it's positive. I can lock this weakness into the whole system, and then the whole body's the tooth. It works. We've been doing it for years. And the way you lock it in is you have the patient, you keep that ischemic grip, keeping the patient weak with that positive TL, and you have the patient close their eyes, open their eyes, just rub that forehead from the glabella to the hairline twice, eyes closed, the brainstem, proprioceptive information, eyes open, frontal cortex. This particular maneuver works all the time. It makes it so much easier in practice. So when you do that, then you can 2-point a treatment, because the right treatment will cause a global strengthening in all those weak muscles. If I'm all number 30, it's positive, then any muscle I test that helps that tooth, arnica or some kind of coenzyme Q10 for the gums or whatever is needed, some kind of antibacterial, will cause a 2-point. Many of you know this. You do muscle testing all the time. So what do we use for the heart? Lots of things. Ubiquinol, I actually threw out my coenzyme Q10. It was so impotent compared to ubiquinol. Ubiquinol is a much more active form of coenzyme Q10, and it works much more effectively, much more assimilable. This is information from Steve Sinatra, one of the few holistic cardiologists in the country. Hasn't gone mad about statin drugs. He's a great cardiologist, great lecturer. So many products to test. Patient may need ubiquinol. Patient may need magnesium. Magnesium is excellent for relaxing the heart muscle. I like magnesium citramate from Thorne. D-ribose, the Carvalin M, very good sugar that helps feed the glucose, helps give the patient energy, especially in the heart. Very good for heart conditions. L-carnitine. Fish oil is very good, anti-inflammatory. Of course, you don't want the patient taking fish oil before surgery because it's a blood thinner. Okay, so we can use all those, but tolle causum, right? We like to treat the cause. So in most of our patients, the issue with the heart is due to the teeth or tonsils, and that's usually due to bacterial infiltration and infection of the heart valves. So treating the root cause, again, going upstream to the tooth, will more deeply affect the heart. So again, the patient comes in to us, doesn't complain about their wisdom tooth, they have this left shoulder problem all the time. All of us as doctors and practitioners very well know that ipsilateral rule. Everybody know the ipsilateral rule? So, familiar with that? If a patient comes in, they say, I have right hip pain, I have right shoulder pain, I got writer's cramp, tendinitis, it's all on the right side. What's the first thing a good biological physician or practitioner should do? Check on the right side, yeah, exactly. Check the teeth, check the tonsils, especially the teeth. This whole one-sided thing, great diagnostic tool. Most of the time, you're going to find a dental focal infection on that same side. Some kind of problem with the tooth. Can be a million different issues. Okay, so if we want to consider most of the time that these are caused from underlying silent focal infections, then I would like to talk about notatum. Notatum 4X. Now, I've got to state that I don't get any kickback or remuneration or any any kind of money from these companies for talking about their products. But if we want to be master carpenters, we've got to have the very best hammer and drill and screwdriver that we can possibly have. So I'm always testing to try to find out the very best quality, the best product you can use. We'll be talking about that a lot in my second lecture. So notatum is a natural anti-inflammatory, natural antibacterial, isopathic remedy. I've been using it ever since it's been available in this country for about 12 to 15 years. Tested it in Germany from the naturopath that developed it. It tests well there too. So it works, remember, not through killing and splattering those endotoxins all over the body into tissues. It works through the wisdom of immune modulation. It activates natural killer cells and macrophages so they can go in and kill and neutralize the bacteria and then eat up the toxic byproducts of that whole war that's going on in the system. So these are Enderlein products, right? These are based on Professor Enderlein products, but they don't contain cell wall antigenic material, which cause healing crisis and disturbance in the system. So I used to use Sonum, and I used to have a microscope and all that too, but as soon as the San Pharma came out, I will just plug them quickly. It's tested 100% of the time better than the Sonum. So do consider San Pharma and you guys have these in your, did you get Sonum? You didn't get any in your thing. He was supposed to give us a sample. Dawn, can you check with Mike and see if he has samples of the notatum? Oh, Mike, did you? How many samples do you have? Can you just place them at the end of a table? I'm sorry. Okay. So it's a very effective therapy, inflammation, antibiotic type therapy without the healing crisis. I use these all the time. I use it for cavitation surgery, pre and post. I use it on an inflamed tooth that somebody's threatening a root canal. It doesn't need a root canal at all. I just laser it in photophoretically. I use it on cuts, bruises, use it after dental drilling, use it after even dental cleaning to use to reduce the bacterial metastasis in the bloodstream to these different focal infections in the body. Yeah, they have injection formula too. They have sips. You don't? Oh, okay. So that's why. Okay. Well, as far as using this chair side just orally or giving it to your patient, it works great. Again, like I said, you can drop on the tooth or tonsils. You can snort up nasally to the sinuses. You can rub on the elbow crease. The Germans, the Swiss, the Austrians, they just rub it vigorously, Einreibung, vigorously on the elbow crease. Of course, the left elbow crease is excellent way to directly communicate with the heart. It's a very highly vascularized area. And so therefore, you're just getting a whole holistic, systemic treatment and an immune system response and protection. So after you do that, the weak muscles should now test strong, and the grip test should not elicit weakness again. If not, you can test another remedy. Maybe they need ubiquinol, ribose, magnesium, something like that. Okay, so we're going to practice, but let me bring Russ up here again. Let me demonstrate. Now, it's important to remember that if we're going to workshop, if somebody in your group is in weakness, is in parasympathetic atonia, okay, 15 more minutes, you can't do this test. Okay, because if they already start out weak and then you have them squeeze, you can't tell anything. Okay, so we'll hand out these so people can test. Okay, so we're going to do the test again. Hold this arm up, hold tight. We're using the left arm. It's good to let them use their dominant hand for the grip test. So he's nice and strong. Now, we can use a dynamometer or you can use your tooth. All right, so let me get my timer. Okay, so Russ, squeeze moderately hard. Now, moderately hard. Okay, now close the eyes, open the eyes. So if you know your patient is positive, you want to lock in that weakness right away. And then what you'll find, hold this arm up, hold tight, is he will be weak everywhere. Okay? So his left ventricular weakness here is systemic. Really neat thing to do. It works very well. Now we can therapy localize a treatment. So you can put this on his energy field. Just put it in your pocket. And just see if we're on the right track. Hold tight. He goes super strong. And then you can take out your product. Go ahead and drop it on. Let's do the left. Not inguinal. Wrong anatomy. Elbow crease here. Such a direct relationship. But, the inguinal crease is also highly vascular, so we use either. Okay. So, now you can have him retest. So, hold on. I think I will. This thing isn't working very well. Have you got 15 seconds? Okay. So, tell him. Okay. Squeeze moderately hard. Oh, he's strong. Up to 40. Usually people stay about 20 or 30. Okay, stop. All right. Then we test again, hold tight, and that no longer causes stress in his left ventricle. Okay? So that's the way you test. He's strong. Now, of course, so I'd consider notatum. I'd also want to go into the heart relationship again, see if there's other issues. Check to make sure, since it was the notatum, which is an antibacterial that helped him, to see if that's any kind of focal infections in the mouth, but I doubt it. But maybe a tonsil, maybe something else. A lot of us dentists and doctors have problems with the very thing that we're working on. So, okay, Russ, thank you. All right, so let's, very good job. So we have 10 minutes to very quickly break up into groups, doctor, patient, teacher. Doctor will test a strong indicator muscle. Have the patient do the grip test, squeeze the ball. If it's positive, then do it again and then quickly lock it in and then test to see if the notatum tests positive, if that's a good treatment for you.
and then repeat the grip test. It should not weaken the indicator muscle. Okay, so let's break up. You got like 7 minutes. Quickly. I have some more. Here, you guys. Here's. Squeeze. It doesn't matter which hand. Yeah. Okay. All right, let's have a seat and we'll wrap up. Thank you, sweet. I thought everybody had a sample in their pocket, so I made a little mistake there. Okay. Okay, so first of all, okay, y'all, good, enthusiastic group here. We're actually running on schedule. Okay, so some comments about the muscle testing and the test. One of the main things, okay, I think one of the main things that was missing is people, I went through this too fast, quickly lock in this weakness. So you know the patient has some kind of left ventricle issue. They went weak, have them redo it again. As soon as they finish that 15 seconds, close the eyes, open the eyes, and they're all left ventricle, just like they're all tooth. Every muscle in their body is weak. That left ventricle is displaying. Then you can see how to help them be a better athlete, or find the focal infection, or test particular products, do all kinds of diagnosis and treatment at the time. There was some talk about it's difficult sometimes to test a strong indicator muscle. Use a big shoulder muscle, or use a more specific muscle like the supraspinatus, 30 degrees in front of the body. That's what the applied kinesiologists do, and they're such excellent muscle testers. So it's a more specific muscle, more precise, more able to see obvious strength versus weakness. But overall, everybody caught on really well, and I saw some great testing. So conclusion, rheumatic disease, illnesses of streptococcal origin are still quite pandemic, but they're just not diagnosed except through us. Dental cleaning, dental drilling, extraction obviously causes transient bacteremia. Is that a big deal? Well, yes, if you have underlying dental and tonsil focal infections or heart disease. And it can worsen these areas or any part in the body that's a disturbed rheumatic field. What's a rheumatic field? An area where strep bacteria likes to reside. Sustained grip test is an excellent dynamic test to reveal underlying cardiac abnormalities. It can help you determine the natural therapeutic supplement. You can give it pre and post dental cleaning, drilling, injection. Like I said, it's on my 5 dental cavitation surgery protocol now. Everybody uses notatum drops and other therapeutic supplements to help support that surgery. And the naturopathic prophylaxis, again, notatum 4X to help reduce and prevent pathogenic bacteria, post-cavitation surgery, mercury amalgam removal, even post-cleaning. You can use chairside or give to the patient to take home. All right, so again, the point is, the reason I named my book Radical Medicine is radical actually means getting to the root or the origin or the cause of disease. Many, many diseases are caused by these chronic, underlying, silent, insidious dental and tonsil focal infections. And we're the ones to diagnose that and to propagate that so our colleagues will know more about that. Okay, so I'm done. Thank you. Thanks.
Great. Even better. I'm Dory Rhoda with American Biocompatible Health Systems. We run talkinternational.com, a mercury toxicity resource website where dentists can list their practices and become very visible on the internet. We also have the interactive Meridian Tooth Chart for your website and your office computers. Web design, search engine optimization, a fantastic exercise system to help you with your occupational hazards. And in November, we're launching American College of Biocompatible Health Holistic Online CE for your office.